hospitals, for the hospital group. So we still have training scheduled for nursing facilities from 11 to noon and case management agencies from 1 to 2. So if you're not in the hospital group and you're in this training, just want you to know that there are all those options that are still coming up on the 9th, 16th, and the 23rd. But, you know, having said that, thanks all for joining and let's have fun with this. Jean.
Jean, you're on mute.
How about I unmute though? That way you can hear my voice. So we are going to be recording this webinar today. We do have the closed captioning feature on. So I'm going to start again now that my unmute button has been deselected. So greetings and welcome to Understanding PASRR with Telogen. I want to start with our agenda for today and the purpose of this brief introduction. We believe it is important to relationship building to share and connect names with faces, to the extent virtually possible, that is. We are going to cover a little bit today about the company of Telogen for those who may be unfamiliar with us as an organization. Then we're going to look at the Telogen PASRR philosophy and what makes us unique. After that, we will provide an introduction to our web-based portal called Qalatrack. Then we'll cover next steps and training and go live. And then we can finish with some time for Q&A. So feel free to bring your questions when we get there. So first of all, who is who and what are their roles in supporting this transition? In terms of our virtual meet and greet, I'm going to start with the Telogen team and myself. My name is Jean McClurkin, and I am an LCSW in 3 states, Colorado, Iowa, and Montana, as well as holding my licensed addiction counselor in Colorado. My role in how I will be supporting this transition is by being the main contact for the clinical implementation. I've been leading the Telogen PASRR effort in Montana since 2019, and I'm thrilled to be returning to Colorado. I have a long personal history in this state as a licensed behavioral health provider. I worked for 10 years for Arapahoe House and in the Denver Metro Community Behavioral Health space, as well as some time working at Denver Health Inpatient Psych. Pam Valvano is the lead for this entire contract that Telogen has with the state of Colorado Healthcare Policy and Financing, or HCPF, which PASRR is just one aspect of that larger contract. She has been supporting Colorado healthcare initiatives for several years now, as she was involved in the Colorado Foundation for Medical Care before it merged with Telogen in 2014. In addition to her passion for healthcare, Pam is skilled in IT systems and loves a good Excel spreadsheet. Stephanie Wilson, who is also on this call today, is our Qalatrack implementation manager, and she has over 19 years of experience in IT systems, implementing new transitioning systems, and she is one of our lead Qalatrack trainers. She lives in Iowa on an amazing ranch, and her daughter is an accomplished rodeo equestrian. Pretty cool. In addition to these 3 named individuals from Telogen, we are currently hiring and onboarding staff that will be dedicated to the Colorado PASRR contract as reviewers of the level 1 screens, schedulers, and level 2 evaluators. We will still be contracting with a range of local professionals to support timely in-person assessments. We believe in providing a dedicated and consistent team so that we can begin to build those successful and deep relationships with all stakeholders. We want you to know our names. We want you to know who we are and how you can reach us for questions. All of our personal emails for Telogen are up there on this slide. Again, we'll be making copies of this slide deck available, as well as copies of the recording available. Telogen is partnering and being supported in this effort by individuals at the state. We have been having extensive communication and shared meetings to prepare for this transition, and frankly, they have been a joy to work with. They also believe in the person-centered vision of PASRR, so we're talking the same language. Obi is the lead PASRR administrator and the one who started off our call at the state. and he is our main point of contact at Telogen for providing oversight to this contract. He's been involved in PASRR for about 4 years. He's also well known among those who know him for being a very dedicated and involved dad. Michelle Voss is the Notice of Determination signatory for the Office of Behavioral Health, which serves as the state's mental health authority. And she is well known for her love of Palisade peaches. Aren't we all? Those are amazing. Also enjoying time down at Pagosa Springs and baking tasty treats for her coworkers, which I can't wait to try. Tricia Stone is the Notice of Determination signatory for the Office of Community Living, serving as the state's intellectual disability authority. In addition to PASRR, she's also the home community-based services waiting list and enrollment specialist. So some of you may know her from that work. She's also well known for her love of animals. Next up, now on to all of you that are attending this training. There are 4 main groups of PASRR stakeholders that all have unique needs and challenges. Hospitals, like all of you folks, that serve as nursing home referrals and complete level 1 screens. The single entry point and community center board personnel that complete the level 1 screens. And nursing homes that both complete level 1 screens and implement level 2 recommendations. And last, but certainly not least, it's the individuals and their collaterals that are the focus of PASRR. Telogen as a company believes in being accessible and supportive to all stakeholders. As those of you that are familiar with Telogen from our other work and our other spaces can attest to, we seek to have open communication and seek out active engagement throughout the entire PASRR process, including post-level 2 follow-up. The goal here is not to add any burden to your already full plates, but rather to assist and support for a consistent PASRR experience. Now for a little bit more about Telogen as a company. For those of you who may be unfamiliar with us, we were first founded in 1972, and we are now 100% employee owned. This means that we have been around in the healthcare improvement field for over 4 decades. And the fact that we are also employee owned is important, as it allows us to all stay very connected to our mission, which is to transform lives and economies by improving health outcomes. Our employee owners are committed to finding innovative solutions to make a difference, an actual difference in the lives of people and in the world of healthcare. Telogen first began as a quality improvement organization, or a QIO, which we remain to this day. We serve Colorado, Iowa, and Illinois. And these roots in striving for continuous quality improvement and member-focused care really do filter out through every other diverse contract we have, including PASRR. We are a national company with our headquarters in West Des Moines, Iowa. We also have offices in Des Moines, Baltimore, Denver, Boston, Chicago, Oklahoma City, Boise, and Richmond. So we really do cover from coast to coast. We currently provide population health management services and IT solutions to over 10 million Medicaid, Medicare, and commercial members. We have over 650 employee owners that stratify into 2 main halves of our whole. First, we have our clinicians working as assessors, reviewers, case managers, physicians, nurses, social workers, pharmacists, and folks that specialize in behavioral health care. And then on the flip side, we have our other half, which is our technical team, working as statisticians, biostatisticians, business analysts, health information technicians, system developers, and reporting analysts. This dual focus on both the clinical and the technical, grounded in a mission-driven employee ownership, really makes us a great team for this work. We wanted to share a few things specific to what makes Telogen unique when it comes to supporting the PASRR process, as that is just as important as knowing who we are. Firstly, Telogen views the PASRR process as a primary clinical opportunity to improve member care over pushing paper for compliance with a federal requirement. Secondly, timeliness, quality, and utility matter. We believe in a system that balances useful, relevant assessments with efficient and user-friendly technology. We want to add value to all stakeholders. Third, we are new to PASRR, but we are not new to healthcare improvement or clinical assessment. This makes us nimble and open to learning so we can adapt to help improve our PASRR process at every turn, while also being able to leverage national best practices relating to the newest requirements for PASRR. A next important aspect of our philosophy is that we are holistic and person-centered in all of our approaches across all of our books or business. And this makes us a great fit for the PASRR program. And finally, we provide good and accurate data on outcomes and follow-up to make sure that we're driving for meaningful change. We are looking forward to partnering with the state around reporting and data collection so that we can assist in tracking trends as close to real time as possible so that the data remains actionable. At this point, I'm going to turn it over to Stephanie to cover a little bit more about Qalatrack. Stephanie, go ahead.
Hi everyone. Thanks, Jean. So I'm going to just spend a couple minutes and kind of walk you through a system that you'll learn more about as we go into our next couple trainings, but it's called our Qalatrack portal. And it is a proprietary web-based system that Telogen has developed to allow that ability to track the data, track the requests, track the reviews, to keep that all in one place and to make sure that it's safe and secure all the time. So Telogen first started development of this program in the late 1990s. Since then, we've been through multiple iterations and we're kind of on our third major release of the Qalatrack system. So what it allows, it's a web-based system, which allows you to access anywhere that you have an internet connection. There's step-by-step walkthrough modules so that you can submit reviews and keep track of all of the information that's in there. As we continue to update and make changes to the system, we continue to make it easier and easier for those of you to use and to submit that information through. So we've tried to streamline that process, make it as quick and efficient for you to get that information in the system and then get that information back out to you. We also make sure we stay up to date on the industry standards and even go beyond those current standards to make sure that all of that data that's entered into the system is secure. So we're protecting all that PHI and PII and all of that information out there so that you don't have to worry about uploading those medical records or sharing that information. It's secure and safe in our Qalatrack system. And also with it being in the web, you have 24/7 access. So you can always see that reviews have been submitted, if they're in progress, if we need additional information, things like that. All of that is always available to you in that portal so you can keep constant track of what you're doing. And again, like I stated earlier, we really try to make the system user-friendly so that it's easy to get at and access all of that information that you need. You can go to the next slide. So we'll talk about this part a little bit more in our next training session, but the way the system works is that you'll need to get access to submit those reviews and view that information in that Qalatrack system or that portal. And so we'll walk you through the process, but for every organization, whether you're a hospital, a nursing facility, whatever, each organization will have to fill out what's called our provider portal registration packet. And we'll ask that a manager or an executive or someone in that organization indicate who they want to be what's called an authorized official. So it's a completely online process. That executive or manager will start the process by saying, I'm the manager of this organization and I say that Jean McClurkin is going to be my authorized official. You do need to have at least one authorized official, but you can have more than that if you want a backup or something like that in case someone is out sick or whatever. That authorized official will manage all the users that have access to the portal. So if accounts need to be created or added, if someone new comes into a role or something like that, that authorized official will get to manage all of those accounts so that you guys have control over who has access to your data. And when those people need to be added or removed if someone leaves or changes positions or things like that. So once that executive says who they want to be their authorized official, the authorized official will receive an email. They'll fill out their piece of the packet online. Once that all gets submitted, Telogen will set up that account. We'll send out your username and then instructions on how you continue to set up your other users. Just as a kind of an update, we do have that authorized official packet out on the website that's listed here at the bottom of the slide. It's the long-term services and support website of the Colorado overall website. So you can get to that now. Again, it's all online, so you can start filling out that information, or you can wait till our next training and we'll kind of walk you through step by step how to do that. Just so everyone knows, you're welcome to fill out that packet as soon as it's convenient for you. We won't actually start setting up users until the last week in February, because once you get that email to allow you to set up your account, the link that we send out is only good for 7 days, and you won't be able to actually access the portal until March 1st. So again, like I said, we'll go through this all in detail at the next training, but I just kind of wanted to give you a heads up on what's coming and let you know that that is now currently out there and available for you to access. That's it, Jean. Oh, you're on mute again.
Thank you. So you can tell because I've got my captions on. So next up, I want to talk about our next steps. So we have 2 trainings coming up following this week's introduction. Next week, like Stephanie was alluding to, February 16th will be part 1 of our PASRR Level 1 training, where we focus more in depth on how to create that Qalatrack account, as well as some basic navigation of the system. So all folks who are kind of targeted to be that provider executive or that authorized official, those folks are really encouraged to attend that first training. As Stephanie noted, you can follow the link in the slide deck that we'll be providing after this training and get an early start, get a jump on creating that account, or at least taking the steps to get that account created, although that is not required. We'll be going through it more in depth next week, but it is out there for folks who want to check it out now. So please feel free, like I said, to start the slide deck is slides 8 and 9. If you're looking for it in the future, those are the slides Stephanie just covered. The following week after that will be the longest training that we have. We're planning on doing about a half an hour, 45 minutes today. Next week will probably be about 45 minutes to 60 minutes. And the week after that, the 23rd, will be the longest training. That will be a good full hour. That training will cover PASRR background and some level setting information to get us all on the same page about what we're doing and why we're doing what we're doing. And we also demo. We'll actually walk into the system. We'll demo how to complete a level 1 form in the Qalatrack system. So each training, like I've mentioned before, will be recorded and available following the live trainings we have scheduled on these Tuesday stakeholder calls. We'll also be publishing slide decks and handouts to serve as both step-by-step guides with screenshots and also little quick cheat sheets for reference. So whatever your learning style is, hopefully we'll have a lot of tools for you. If you like watching videos, if you like just reading the details, or if you like just reading the highlights, you'll have your option available. All of this is in preparation for a system go live on March 1st. So the system will not be open until March 1st. So we're doing all of this work in preparation. And again, March 1st, coincidentally, is going to be my son's 3rd birthday, just to let you all know. I'm very excited about that day for many reasons. So now I want to thank you for letting us present this introduction of who we are and why we're here and what we're looking to do, and put some names to faces so you can see who we are. We're real people on this process for you. And I'd like to kind of open it up for some question and answers. We have the 3 folks at Telogen I mentioned. We have folks at the state that are here. If any of your questions are things that we're going to be talking about on future trainings, I might stop you and say, oh, we'll cover that in a week, or we'll cover that in 2 weeks. But we'll definitely wanted to hear your questions and hear what's on your mind. If you have any feedback, I know we've got the chat feature as well. I'm going to check the chat real quick. So yes, I think I see a question from Anne Marie about, does this mean we will need to start completing PASRRs at the hospital level again on March 1st? And since we have Obi here, I'm wondering, Obi, would you mind taking that question? And I can also pull up some more questions in the chat box.
Sure, thanks, Jean.
Yeah.
Let's see. Okay, previously will not be. Yes, that's correct. So the current 1135 waiver and the 30-day exemption will expire by April 21st. That means that effective April 22nd, we will resume all PASRR requirements with regards to pre-admission level 1 and level 2 and every level of the PASRR process.
Mm-hmm. Thanks, Obi. So Anne-Marie, hopefully that answers your question. If it doesn't, please add something into the chat box. But yes, so the 1135 waiver being in effect, there's still that exempted hospital discharge where people can admit straight to the nursing home, and then the nursing home will initiate the PASRR process after 30 days. That is, like Obi said, going until April 24th. Next question was from Brittany Bear to Obi that said, oh, previously mentioned PASRR would not be reinstated until 4/22. Can we clarify? We just did. Next up, so Brittany, again, if that didn't answer your question, just rechat something. Deborah Campbell, how do we sign up for the next 2 trainings? Excellent question. There is no sign up for the next 2 trainings. The link is out there and available to you on the state's PASRR training website. And I can either Obi or Shelly, could one of you add that website into the chat box while I'm talking, just so that folks can have that website? So all you need to do is click on the link. You don't need to pre-register. You don't need to tell me that you're coming. I have been tracking all the folks that accept the calendar invite. That's been a really helpful way for me to know about how many people we're expecting. Not a requirement. This really is a training we just want to get out there to as many people as possible. We do not want to put barriers in your way by making you have to register or sign up early or confirm. If you're able, show up. And again, we'll have the recording available. And then Deborah had another question, which Obi, I might go to you as well. Is HCPF considering implementing the physician waiver? I'm wondering if that's the same as the 1135 waiver.
I'm assuming that, is this referring to the exempted hospital discharge? Is that what we're referring to here?
I'm referring to as a standard practice, even post the current waiver. I know that it's optional for states to do this, but implementing a physician waiver for the PASRR level 1.
No, we have no such plans at this time. If conversations were to come up in the future regarding that, I'll definitely keep everyone in the loop. But at this time, we have no such plans.
Okay. Thanks, Deborah, for getting off mute there and helping us out. The next question in the chat box is from Emily Fox. Will Qalatrack house historical PASRRs and determinations? Qalatrack as a portal will not house that information. However, the Telogen team will have access to that information, as will the state's team. It just won't live in the Qalatrack system. But as soon as things are entered in Qalatrack, they will forever live in Qalatrack. So we will start accruing our own history. But for everything that's been done prior to the opening of the Qalatrack portal, it'll be living somewhere else that we will all have access to. And then Melanie Baker asked, you mentioned that you're new to PASRR. Do you provide the portal for PASRR completion in other states? Yes, we do. So we work in Montana. So we've been doing Telogen and PASRR in Montana with the Telogen system there. And it's been working very, very well. I love doing it. I'm a clinician. I do the level 2 evaluations myself, as well as managing the program. I help with any overflow scheduling, and it's the best part of my day, getting to do that and use our system. I personally, maybe I'm a little biased, but I do think it is very user friendly and it saves me a lot of time. And Maurice, yes, it answers your questions. And Obi added the website. Will trainings recordings be emailed out to attendees? No, we're going to be posting them on the website, on the HCPF website, to get the training slide decks and everything. I believe that's where everything is going in terms of our educational material. We wanted to have a one-stop shop for where you could go to get it. So I believe that one-stop shop, and Obi, please help correct me here, but I believe that's going to be on the HCPF website. And then we'll just share links to that website at different places. But keep it all in one spot. Then Melanie Baker's question. Oh, that's what we asked. Just found the handout under trainings. Thanks. So there we go. Will this be for long-term care only or all IP notifications? Carol, I'm not sure I understand your question because this PASRR is for everybody admitting to a nursing home where the nursing home is licensed to accept Medicaid. So we're housing this with the senior long-term services because the other scope of work Telogen has under the contract is around senior long-term care services. PASRR specifically is not necessarily senior long-term care. It could be for people just going to a short-term respite for 3 to 6 months. So that PASRR lives a little bit differently than that. Did that help, Carol?
Yeah, that helped with that, answered my question. Thank you.
Yes, no problem. Okay. And then, do we have any other questions from folks? This chat's been really helpful. I will also, people can go off mute if you want to go off mute and just ask a question. If you've got people that are on the phone that haven't dialed in to see the slide deck and you have a question, please feel free to just unmute and let us know. We've been going for about 30 minutes and I was hoping this would be about a 30, 45-minute presentation. So we're kind of right on the money with our expectations, which is nice.
Can you please review again where we can find our next training?
Sure. So the next training will be through these stakeholder calls. So the links to that are on the website that Shelley added to the chat feature, which is colorado.gov/Pacific/HCPF pre-admission screening and resident review program. There's a training tab on that website, and underneath the training tab are the handouts that have the Zoom link to these meetings, that have the passcode to these meetings. Again, we want to make it as easy as possible for people to dial in and sign up for those. Okay, and does a PASRR need to be done for patients with no mental health or DD diagnosis? From Mary, excellent question. The PASRR level 1 screen is done on everybody, on anybody that's admitting to a nursing home from a hospital, from the community, if the nursing home is licensed to accept Medicaid, which most are. So we have a very nice automated system where for folks that don't have any indicators of mental health or IDD, if you've selected no to the questions in the screen, then you get an immediate notification that you can proceed with PASRR and proceed with the admission, that your PASRR is done. So it does need to be done on everybody, but the level 2 screens are only really done for folks that have a suspicion of mental health or a DD diagnosis. We will cover all of that at our next training and the one after that. So we're going to dive deep into exactly how this is required, how you fill it out, and what you can expect based on the answers you give us in our automated system. Telogen, level 2 screens on the weekends. Telogen as a company will not be doing level 2 screens on the weekends. However, we are contracting with external providers in the state of Colorado once in-person assessments can resume again. And those in-person folks have the freedom to schedule it whatever best fits their schedule. So it's entirely possible that a weekend option would be available for folks that have that in their schedule as evaluators. But Telogen as a company is Monday through Friday, standard business hours. So that's when we'll be doing the bulk of our assessments for the level 2. Will determinations still be made on Monday through Friday? Yep. The nice thing about our system is that the manual reviews will be Monday through Friday, but the automated approvals are 24/7, and you get that notification right away. So again, if you've got a member that has no history, no suspicion of a mental health or an IDD diagnosis, you can get an automated approval within seconds of submitting that. Then someone else asked about the turnaround time for PASRR level 1. I will share, as I'm going to share in these trainings coming up, that we have a 6 business hour window with the state requirements for us. And we plan on holding to that so that we review the level 1 screens within 6 business hours of getting them. If they need the manual review, again, if they're automated, you get it immediately in terms of getting what your outcome is. So, and we'll cover that in more detail as we get into the trainings, but I do feel it's perfectly fine for us to share that we have an expectation to try to get these done within 6 business hours. Any other questions? These are great questions. Okay. Not seeing any more for the moment. I'm not sure, Obi, Shelly, Trisha, you guys have.
Can I say something with regards to the instant notification that you just mentioned, Jane?
Yeah, please.
So for the hospitals, I mean, this group, I'm sure that they will be very happy with that feature, because that's one of the points of challenges that we've had in the future. Specifically, I'm talking about some, unnecessary delays with, being able to get a turnaround on the level one review. So the instant notification will be a great feature that will help really facilitate things and help us to avoid unnecessary delays, so that hospitals can discharge and nursing facilities can admit on a super timely basis. So that's something that I'm sure they will love.
Thanks, Obi. We've had a couple more questions, which I think are great. So Evan wants to know, will you be doing your level 2 screens virtually or in person? Another great question. We will be leveraging telehealth to the extent that it's clinically relevant. We have a very detailed phone screening process when we go to schedule the level 2. We really want to make sure that it fits the patient, that it's clinically appropriate. If both of those are true, we will schedule that via telehealth, and we have this online Zoom platform, HIPAA compliant, that Telogen has experience using in multiple other assessment contracts we have. We found great utility with doing that. It allows us to schedule things efficiently. And then that actually leads into the next question, which is how long are the level 2 PASRR reviews projected to take for turnaround? And we're aiming for 5 to 10 business days. That really is our goal, to try to get these turned around quickly. So when I shared the slide that said timeliness, quality, and utility matter, I mean it. We want to give people, in order to make this person-centered, in order to make PASRR relevant and helpful, it needs to be timely. It needs to be turned around and actionable to the people that need the information. So we are very committed to making that happen. We know nothing's ever perfect, and our in best case scenarios, but we always know we have to live in reality, but we are shooting for quick turnarounds here. That is our plan. That's what we've been doing in Montana for over a year. So the 5 to 10 day business turnaround for PASRR from level 1 being entered into Qalatrack to the level 2 getting a notice of determination, 5 to 10 business days is our goal. So hopefully that helps there too. Any other questions? Let's see here. Is anybody on the phone that doesn't have access to a computer, that's not seeing the screen, want to ask any other questions? Oh, okay. Here's one from, let me move my thing out of the way. From Amber. You mentioned that we could set up our account prior to the next Zoom meeting. Yes, you can. So there is a link in this slide deck that, again, as soon as we publish that, you'll be able to access that. Look for that to be published hopefully tomorrow. We do have 3 of these trainings that we're doing today. So we wanted to wait until the trainings are done with all of the stakeholder groups before we publish the slides. So look for that tomorrow. There is a link that you can go to which already has that guide for the authorized official, which has the link to the virtual documents. You can have your provider executive start signing that now. You are very welcome to do that. Again, we will be covering it in detail next week. So if you don't have time, you want to wait till that full training, please do. You're not going to be missing anything, as again, the accounts won't get their links to actually go in and create passwords until the last week in February. Because I want to reiterate what Stephanie said, as it's very important. The links that we send with temporary passwords to create your own password in the system are only effective for 7 days. That's 7 calendar days. So we wouldn't want those coming out any sooner, because the system won't be live until March 1st. So again, you can get a head start on the paperwork by accessing that link in the training now, by downloading the authorized individual user packet, by starting to fill out some online forms. But again, that last step will wait until the end of February, regardless of when you've started the process. All right, next up From Emily, are the PASRs facility specific? Will the hospital have to wait to submit the PASR until we have an accepting facility? No, we've actually been expecting this. So we know full well that when we're sending folks to nursing home, we're making referrals to lower levels of care, that there is often a change, right? Sometimes it's a change we could have been anticipating. Sometimes it's a last minute change relating to bed date, relating to capacity. So our system has the ability to change what we refer to as the accepting facility, as the treating provider. We have the ability to switch that during the course of the PASRR process. So if by the time you submit the level 1, you have one facility that you're, assuming is going to be the step down, but then during the course of the level 2, during the course of the assessment process, it changes. Instead of ABC over here, we're going to go to XYZ because the bed opened up and it's closer to the family. We do allow for that. You will need to indicate an accepting facility when you complete the screen, but you have the ability to change that midstream if you need to. We recognized that reality. Next question from Todd. How easy will it be to renew a PASRR once they expire? Will we have to complete a new application in the event a PASRR expires? So I'm not quite sure, Todd, because PASRR doesn't really have an expiration date. There are reasons for what we could now call provisional admissions, what we used to call categorical determinations, and those are time limited. That's on the nursing facility side. So those exemptions, with those, and there's for the convalescent care, for the exempted hospital discharge, for terminally ill patients, there's a couple of exemptions that could happen. Those are time bound. Those are either for 14 days or 30 days. At that point, when that expires, the facility, the nursing facility, would restart the PASRR 1 process if the member's still there post that time frame. But for the hospital side of things, if you get a provisional admission, that time frame doesn't start until the member admits to the nursing facility. Alicia Horan, sorry, just to clarify, we will start completing level 1 screens on March 1st. Will not have to, nope. Let me clarify that. Alicia, you will not have to do a PASRR level 1 screen until 4/22, until in April, because the exempted hospital discharges, I'm going to let Obi answer this one. I want to make sure I got that right. Obi, can you take this question from Alicia?
Sure. Thanks, Jen. Yeah. So yeah, the 1135 waiver, the 30-day exemption is still fully effective until the expiration date of April 21st. Starting April 22nd is when we will resume a normal PASRR requirement. I also want to mention that that's the plan right now. And it is possible that things may change, but I'm not going to make any suggestions or speculate. I'm just going to say, let's continue to plan with the April 22nd effective date for all new level 1s and level 2s. So, just like Jean said, hospitals, you don't necessarily have to do anything until April 22nd, basically, unless on those rare cases where there are serious psych, cases that require level 1. You can work with the nursing facilities to follow the process just like we've been doing. Thank you.
Okay, thanks. Thanks for clarifying that, Obi. Next question on here is from Diana. Are any of the other questions different on the PASRR, or is it the same format? That's another great question. We do have different questions. We have a different form. We have a different system. And that's part of what the training on the February 23rd is really going to be focused on. Here are the questions. We've simplified the form. I think there's 13 yes or no questions that we're going to cover when we demo the form, when we give you the slide decks about it. We really want to make sure people understand the purposes of the questions. Since they are streamlined and simplified, we want to make sure they're understood completely, and we all have the same page for how to fill out the form. Because again, consistency really matters. So that's going to be the training on the 23rd, where we do a deep dive into those questions. But I can say that they are different at this time. We'll still be utilizing PHQ-9 or GAD. Nope, we're not. We're the PHQ-9 and the GAD-7. If that's, I think, what you were asking for with the GDS. Those are not part of the PASRR process at this time. Will these forms be uploaded to the PASRR website? Right now, the forms are electronic only. They do not have a PDF component. It isn't an online system, so we don't have any forms to upload to a PASRR website. Training documents and screenshots will be uploaded to the website. So you'll be able to see the questions through a slide deck, see the questions through a handout, through a tutorial, but you will fill out the questions in the online system. There's no form to fax or upload. And the upcoming training dates, I will repeat those again. So next Tuesday, that is February 16th at the same time, we're going to be doing the PASRR Part 1 training, where we do the deep dive into Qalatrack. We go through how to get your accounts, what basic navigation looks like. So it's very much portal heavy. And then the training on the following Tuesday, which is February 23rd, will be about the form, about the PASRR process, about what does PASRR mean, who has to do it, when do you have to do it, and a lot of that good, again, level setting information. Next question. Oh, someone said thank you for the clarification. You are welcome, Todd. Next up, users will be able to see submitted PASRRs from others within their facility. Yes, so that's another great question. And we will dive into this more, but I can give you a high level answer now. There is visibility for everybody connected to an MPI or an organization that initially submits the PASRR. Anybody at that organization can then log in and see that PASRR for that member. Our system is very much designed similar to an EHR in that there's a member hub. And that member, everything that happens for that member is included in their member hub. So if you have access to see a review or see a PASRR submission for that member, you can see that when you go to their member hub. You might not see other things that have happened to them in their system if you weren't a facility connected with that event. But we do have agency-wide visibility within Qalatrack. So that's, I think, a good question. And Obi added the link again for the training. Thank you, Obi. Emily, if a person triggers a level 2, will there be information we need to upload to the Qalatrack system? Yes, actually, that's another very good question, which we will cover in the subsequent trainings. But again, I believe that repetitive information is helpful information. So I will share that now. What we do ask when you submit the level 1 is that you submit a H&P, a history and physical, and a med list. That's it. We just need an H&P from within the last 3 to 6 months, or more recently if possible, and an active med list, the most current med list. So that's all the information. You upload that directly to the portal as you're filling out the level 1 screen. What that does is it allows us to do QA on the back end, because even when you get your automatic notification, we are still going to go back and QA representative samples. So we're going to need to match up your answers in the level 1 screen to the H&P you've uploaded. So it's very important to upload H&P and med list. Once those documents are uploaded, if we need anything else, we'll let you know. But it saves a lot of time if you guys can just upload that recent history and physical with vitals and a med list. And that will be all that you have to do when submitting the level 1. And that will be the documentation used for the level 2 review. So it really does save some time for everybody if that content's uploaded at the time of the level 1 screen. And in Qalatrack, it's really easy to just drag and drop. It's nice. Okay. And I think we are at 47 minutes here. And I'm looking at my time. We have about 14 minutes to go. I do have one more slide to share to sum things up. So I will also note that our emails, my contact email, Pam's contact email, Stephanie's contact email, we want you to have it. So it will be part of the slide deck. If you have questions, please let us know. I believe there's no such thing as a stupid question, and I'd rather have people ask and give me an opportunity to answer rather than either making an assumption or feeling like they're ashamed of their own question. Please bring it. No judgment, just open request for information and questions. So with that, I'm going to put the chat to the side, and I'm going to move to our last slide here. So in summary, putting it all together, let me kind of go through these points because I do believe this content's important. So I just want to leave folks with these points, right? So PASRR is a person-centered process that provides an objective clinical assessment for folks that could potentially benefit from additional services at the nursing home level of care. This is specific to PASRR conditions. Nursing home transitions are vulnerable times for individuals and their families. And we want to be mindful of that and how we approach PASRR in Colorado. PASRR is a federal requirement that's been around for over 3 decades and continues to maintain relevance and provide benefit for individuals, as evidenced by that continuing to have resources through PTAC. They've got new webinars that come out every month, and they just did the notice of proposed rulemaking in 2020. So they're keeping it fresh, keeping it updated. PASRR is also a clinical opportunity and not a paperwork compliance requirement. That's very important to us when we think about how we support PASRR. We really do believe that there's a great deal of clinical utility that comes from having an outside objective eye mindfully review and assess individuals when appropriate. And if not warranted, then quick turnarounds to close the PASRR process. So that's really, I think, 2 parts of our philosophy that I really hope you take away, is that we want to be efficient where we can and have clinical relevance where we can. And they both depend on each other, right? If we spend all of our time reviewing level 1s for folks that don't have a PASRR condition, we wouldn't be able to do mindful level 2s. So we've really tried to, again, find efficiencies where we can and make a difference clinically when we can. And that gets into the next point here of turnaround times, and the utility of the output documentation matters. It's key to the success of a PASRR program. It should not take you weeks to get actionable information as you look to begin working with new residents, waiting for feedback around appropriateness of a facility specific to PASRR before you can admit. The documentation you receive post level 2 or post level 1 should add value and be consistent. By leveraging our system automation, we have a unified team, and using telehealth, we feel very confident that we can help improve this process for all stakeholders. Those are the points I really wanted to just leave you with. So in closing, I encourage you to think about a key takeaway for you from this training. In the last 50 minutes, was there any nugget of information that you learned that will stick with you as you move forward with understanding Telogen's role in PASRR? And then what, if anything, are you going to do differently? Are you going to maybe attend a training next week that you hadn't been planning on? Are you going to tell a coworker about this process that you hadn't been planning on? Just really think about those 2 things as you leave. We spent 50 minutes together, and I really appreciated it. And for those of you that did ask questions, thank you very much. I appreciate you stepping out on a limb and being vulnerable like that. I appreciate continuing to get to know everybody. Obi, I'll turn it back over to you.
Yeah, thanks, Gina, and thanks everyone for participating in this process. I'm super excited, and I feel lucky to for us to have the opportunity to work with Jean, Pam, and the rest of the Telogen PASRR team. I'm very, very confident that we're going to achieve great results for our members, for our clients. So I look forward to it. The one little thing that Jean mentioned during the training that I just wanted to kind of repeat or echo what she said under the provisional admissions. You know, the hospitals have been really asking questions for a while about the hospital discharge exemption. For the last 4 years, we've had conversations around it, and I'm excited to say that finally that's going to be a reality now with this new Qalatrack system with Telogen. Hospital discharge exemption will be part of the provisional admissions that will be implemented in the PASRR process. So I think that's really great news.
Yeah, looking forward to it, everybody.
Yeah, thank you all.
Okay, I'm going to stop the recording now, everybody.